Hey, and welcome today from sunny California. I have a special guest, Dr. Joy Kong. You are a specialist in stem cell therapy, which I actually have a little bit of experience in. And thank you for joining me on the podcast this morning.
Oh, you're so welcome. I'm excited to be chatting with you.
So, like all my guests, I Google and stalk them to find out a little bit about them before we get going. So I'll give a little bit of insight to the guests, what I found out about you, but I'm going to turn the story over to you so you can tell us, how you got to this place with stem cell. Oh, here's the cat. we just talked about that, and as to be expected in our lives, we have cats, animals, children, washing machines into the podcast. So we'll just keep going because it's all good here. So what I found out about you is you've been named the top doctor of the year in stem cell therapy for 2019, but it gets even better, the top stem cell doctor of the decade, 2021.
Thank you.
Well done. It's so cool. So I feel honored that I've got someone that is really deep in this this new, well, I think for a lot of people it would be a new genre of how to deal with healthy aging. You completed your medical training at UCLA, specialised in psychiatry, and then turned your focus to integrative medicine. Love that. You're a leading doctor in stem cell treatment, obviously, and for anti-aging, as a lot of podcast guests and listeners know, that I have flipped that anti-aging a little bit on its head, and we call it healthy aging. And with that introduction, I'd like to invite you to tell us a little bit more about yourself, how you got from UCLA to stem cell regeneration.
Yeah, so that really, I think it has a lot to do with the fact that I grew up in China. I spent my first 20 years in Beijing, and that's where I had kind of this medical experience, as far as what's allowed, what's effective, and what's part of life when it comes to day to day, if we need any medications, and Eastern and Western medications were kind of intermingled together, manifested by our family medicine drawer. There's no discrimination. So to me, it's intuitive, of course, one will work better for something, another, modality works, best for something else. So there's this kind of a dichotomy of acute conditions like infections or injury that Western medicines are superb at, whereas when it comes to chronic conditions and nurturing long-term health, Eastern medicine really shines. And I've seen that, not only from, just from everything around me, but even from my own mother, who got cured of a very malignant form of blood cancer, multiple myeloma, after she got chemotherapy, which she almost died, and most of the patients in her ward actually died. And that's when she said, okay, get me out of the hospital. I think I'm done with this. And that was 6 months of chemotherapy. And she went home. She went to a Chinese medicine doctor, got all the concoctions, started drinking herbs, and started doing aerobics. So within 6 months, everything was normal. She went back to work full time, and she lived for another 32 beautiful years. So that's a personal story. So I know the power in Eastern medicine in this more holistic approach, because what's Eastern medicine? I think the same for Chinese medicine, Ayurveda. It really is looking at the body as a system, because so many things can present as a particular symptom, but it can come from different organ systems. So you don't look at eye just in a separate system of an eye. You look at everything, even the energy paths that flows through, what else can affect it. So when I went into medicine, I always had intention of borrowing that kind of wisdom into how I treat patients. Of course, I went into psychiatry because I loved the mind, and I think it's fascinating as the last frontier, and that's what make us human. So when I try to incorporate these more holistic approach, and I realized that there's really very little I can go on. And when I tried to use Chinese medicine, the Chinese medicine is completely different language, it's poetry, so here I'm in science and I love science, but I couldn't really bring poetry and science together. And that's when I had an aha moment when I saw this. You don't like the word anti-aging medicine. You can call it, functional medicine, holistic medicine, integrated medicine. They all have the same philosophy. It's looking at the body as a very complex whole. And then you want to address many, many, many things all at once. You don't just focus on one cause and one result. Instead of addressing the body like many, many linear relationships, you want to address the body as a web. So, you don't want to just be narrow-minded, which is what I've seen at Western medicine. It's becoming a little myopic. And in that sense, I think it's almost presumptuous and arrogant to think that you can find one thing linking to another, completely disregarding everything else that's affecting this very complex body. So that's kind of how I got into this whole field of, the buzzword anti-aging medicine. I'll just call it, integrated medicine. And of course, stem cell therapy, it can be more integrative and holistic than stem cells because you're using the body's intelligence. You're using the intelligence that created us to borrow it to help heal the body. So that is you're definitely addressing the whole web because you're addressing, one single cell may have, all these 10 different main actions, but they may talk to another 1,000 different kinds of cells in your body, all speaking different language to these different cells. So you're very, very holistic in the results you're getting. So that's kind of the story, kind of long-winded story of, how I got from psychiatry to integrative medicine. Of course, now I don't really do psychiatry per se, because I think everything should be under the umbrella of integrative medicine. So if somebody has mental health issues, let's look at what's wrong with your body physically. Yes, psychotherapy is important. That's fantastic. But we want to address everything that may be causing your depression and your anxiety. And I think that is a better way of practicing psychiatry, frankly.
I mean, as you're talking, I've just got all these ping, 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 ping moments of things that you're talking about. So as you're probably aware, I spent 20 years living in Asia, spent a lot of time in China, and obviously surrounded by lots of incredible Asian women that I learned so much from, and especially on the Chinese medicine side. One thing that really stood out for me was they never seem to age. Right, so here we are, expatriates in hot tropical countries, soaking up the sun, and then obviously the skin really starts to is impacted by too much time in the sun. And of course, all my friends, we're sitting out there together and they're like full sunblock, big massive hats, and then sitting in the shade and not going out into the sun until like 6 o'clock at night. And then you're looking at them and their skin is incredible, right? There's no way that over 10 years they've aged. And so I think, I can identify that just from sort of personal experience. But so how did you come to focus on stem cell regeneration? Because that is actually a little bit of a buzzword, and particularly when it comes to longevity, healthy aging. And as we age, we start to experience some health challenges. And for me personally, it was around joints and bone pain and cartilage and things like that. So how did you come to get specifically into this area, and how accepted and well known is it in the US?
There's a particular doctor who actually turned me on to it, and he was just really excited talking about using stem cells to treat patients. And I remember this is how most doctors are. We are so locked in what we've been trained for that we don't know what's going on outside. So my question, I have been practicing medicine for over 11 years at the point. And then when he told me about using stem cells, and I said, you mean you can actually use it? You can use it clinically? I thought people were just studying it. I mean, that's how limited I was. never mind, research has been going on for 20 years, but because that wasn't relevant to my field, I would just, didn't get into my consciousness. And that's what's happening to probably 90% of doctors. I hate to say that. So, good luck with patients, wanting to clear this with your doctor, because your doctor really have not paid attention. Most likely there'll be very rare doctors who, on top of a busy traditional medical practice, have the time to, they have some time probably to keep up to the field they're dealing with, but stem cells, I doubt it. So that takes a very special person, very open-minded person to actually want to seek out that kind of knowledge. So when this doctor told me, yeah, I use stem cells to treat patients, and look at this kid I treated. So this is an autistic kid. So of course I light up, because, in the fields of psychiatry, autism is a big field. And it's a very frustrating field, which was one reason I did not get into child psychiatry. I actually really wanted to study child psychiatry until I did rotations where we had to deal with autistic kids. And I could not, there's no empathy, right? No relating. So when you can't even get emotional, exchange with someone you're treating, there's definitely not much reward. Right. First of all, there's not much reward, but then, and also the tools we have are so limited that you can't bring about, really meaningful interactions. Yes, there may be some progress, but honestly, because I've been at some of the best institutions at UCLA, at Cedars-Sinai, and that's where I observed the top-notch, supposedly top-notch psychiatrists, how they're treating autistic kids. Unfortunately, we're not making progress in making these kids more interactive, have better concentration, better social interactions. We're trying to make them calmer. Mostly, if they could be calmer, then we think we're being successful. They're not having so much hyperactivity. They're not destroying things, so that's the goal. And a lot of times I see sedating medications, and that's the way these kids were treated. So I mean, intellectually, and emotionally, just not satisfying. I didn't want to go into anything like that. And this doctor gave this kid stem cells from the umbilical cord. And he said,
topic.
yeah. And then he said, look what the teacher sent me. So the teacher sent her observations of this kid. And there are probably 40 things the teacher had noticed that changes in this kid. So language, ability to speak, ability to play with other kids, being calmer, not hyperactive, and being, not throwing temper tantrums, and, not procrastinating, actually getting things done. I mean, all these different things, 40 things, right, from the teacher, where I can't imagine if I do traditional child psychiatry and I see 2 things, I'll be so proud. But this is transformative from one treatment. And I was astounded. I said, what incredible tool. I can't believe this is just from another human being. And you can create that kind of healing. So that was first when I was, really excited. And then I started learning and reading about it. And of course, what nailed it was when I had my first patient myself. So this is somebody that was kind of a friend at the time. And he said, I want to try this because I had 2 orthopedic surgeons who told me I absolutely need bilateral knee replacement. And I'm very active. I really don't want to get a knee replacement. So why don't I give this a try? So when it comes to something of a larger joint, like the knee or shoulders or hips, so you want to attack the joint because this person is older, right? 69. So I would say anybody, if you have a lot of persistent joint problem and you're over the age of 45, 50, very likely is osteoarthritis. And what is osteoarthritis? It's really a degeneration of your body's ability to repair. So it's this inflammatory state in your whole body that's not allowing you to repair the wear and tear that we talk about, that we think is the cause of osteoarthritis. No, it's not, because if you think of us as 10-year-old kids, we're wearing and tearing our body to pieces. And guess what? We're fine. So we're not getting osteoarthritis. It's because we have so many stem cells, we fix it right up. So this is a full body kind of a lacking regenerative potential type of condition. So what I do for larger joints is that I will give an IV infusion to improve the whole body's condition. Also, the outer 1/3 of the cartilage is nourished by the blood supply. And then I'll inject into the joint space because the inner 2/3 of the cartilage is nourished by the synovial fluid. So you attack from both ends. And so of course, this is 5 years later, and he's walking 4 miles every day. He said he barely feels that, he has knees. But what's really funny was the very next day, I said, how are you feeling? He said, this is very strange. I slept through the night, because for the past 40 years, he was waking up every night in the middle of the night when he shifts his body, because he had a rotator cuff injury when he was young, and that never healed. So every time when he shifts, he would just wake up from a sharp pain. And that next morning, he said, I didn't wake up. And then he never was woken up from his sleep again. This was mind-boggling, right? I put it into his intravenous system. I never knew about his shoulder injury. We're trying to fix the knee, but the cells have their intelligence, and the shoulder has been screaming for help. It just didn't have enough horsepower to fix it. All of a sudden, I infuse this intelligence, and the cells are really attracted to screaming areas of injury, and the cells send just the right signals, calm down the local injury, recruited the immune system to take away bad cells, and to to give the right environment. And these cells also have direct conversations with local stem cells. So you do have local stem cells, but if they're in this highly inflamed condition, they can't even function. They can't do what they're meant to do. So then you have this holistic, you bring about this healing, and it's amazing how rapid it is. I mean, it was shocking. I mean, that was my first patient. I thought, this is incredible. I mean, imagine being a doctor and seeing this kind of response. I felt really powerful. I was like, this is why I went into medicine. I can help people. I can do all this. This is just really, it's so rewarding, and it's fun. And it has been like that ever since. I love the fun. Because
I've actually never heard a doctor say my job is fun. So yay to you.
So I just, it keeps happening. I keep hearing from other patients. I never presume that what I do is going to create incredible results. Because you never know, there could be a lot of factors. So I always kind of silently pray, I hope this is going to help this patient. I really, really, really hope that she's going to get better. He's going to get better. And then the response they gave me, afterwards, some days later, a few weeks later, it just is amazing. People who have suffered from, sometimes decades of problem, long-term problem, and then it was going away. They regained their their mobility and sense of wellness. And it's just it's definitely fun.
It's so amazing. I'm so happy to hear that, because maybe some of the podcast listeners will know about my own personal experience with stem cell treatment. I was just really lucky, and I want to share that I've also had incredible success. So as a personal advocate of stem cell treatment. So my experience was living in Southeast Asia. There's a clinic there called the KL Sports Medicine Clinic. And I had a partial ACL rupture in the knee. So the anterior cruciate ligament damaged through skiing in my 20s, but not enough to have surgery. Because I was young, I could still move. I did a lot of rehab and went on to do lots of crazy things for another 25 years. To the point that because of the instability in the ACL, I wore down the cartilage quite significantly, and got to a point where it was very, very painful to walk or run or teach classes. I taught group fitness, dance. That was sad. And then I did a PT session one day with a trainer, and he made me run down the field and turn around and run back. And on the turnaround, I snapped the rest of the ACL, and it was time out. So I was really lucky to live like within literally walking distance, although I couldn't walk, to the KL Sports Medicine Clinic, and a recommended doctor there, Dr. Saw, who is very cutting edge in the field of stem cell regeneration for knee treatment. So he's been doing it for well over 20 years, but he's never had the support or the funding or anything because it was all so new and, you know, wah guru kind of thing. But I watched people go through his treatment and get on a treadmill and start running again after years of not even being able to walk properly. And I was starting to think, this guy could help me, you know. So I was lucky enough, because of my ACL tear, that I was having the surgery under private insurance. So, but the stem cell treatment, no, obviously, yeah, because it's, you know, we're talking like a decade ago. So what I did was I had a donor ACL ligament put in, and he drilled up into the bone to create the inflammatory response to receive my stem cells. The day after surgery, they took out stem cells through my femoral artery, spun the blood around, put the fluid back in, kept the stem cell part, and then within a couple of weeks, he was injecting the stem cells back into the knee capsule, into the space, with a little bit of, what do they add to beef up your synovial fluid that's decreased over time? What do they put in there? Hyaluronic acid or something? Anyway.
Hyaluronic acid, yeah.
Yeah. So there was a bit of that as well, but it was mostly my stem cells. And for the cut a long story short, I have been incredibly active for the last 10 years. So it was really successful. It did take a year to build up the cartilage. I continued to have regular stem cell injections up to a year. Now I've moved back to New Zealand and I'm having this conversation with you, and I've got stem cells saved in Kuala Lumpur.
Oh.
And I've got a few little things happening now in the body because of perimenopause. So with perimenopause, you get some extra joint pain, and I'm treating that with HRT and things like that. Okay, and then the next thing is cord blood banking. I feel like we're going to talk for a while. So I had a baby 8 years ago, and I saved his cord blood, and I wasn't to know that he is neurodiverse at the time. And of course, over the next few years, we were able to figure out that he has a neurodiversity, dyspraxia, and his cerebellum on his right side is smaller than his left, so it affects balance, coordination, and speech. And I have his stem cells. So I'm just saving that until someone like you can figure out what I can do to help my son if I need to use his stem cells. So there you go. Pretty cool story, right?
Yeah, that's great. So, so your son is having right now, how old is he?
Well, he's 8 and he has a diagnosis of dyspraxia, which is not uncommon. We're doing a re-diagnosis because as they grow up, there are other things that present themselves, possibly ADHD, some dyslexia. So we're not quite sure how that would be positively impacted by stem cell treatment right now, and I'm happy to wait. We'll do everything else that we can to help support him in the meantime. But I am incredibly open-minded to this opportunity.
Yeah.
Anyway, I do want to go back because we want to talk about the healthy aging aspect of what you do.
I just want to say a couple of things about cord blood. That's where I started when I started using stem cells, for treatment is from the umbilical cord blood source. Unfortunately, the cord blood has almost no mesenchymal stem cells. And now, we are looking at mesenchymal stem cells almost like a mainstay, or, for some people, a holy grail of stem cell therapy. So these are, the type of cells that are around your blood vessels, everywhere in your body where you have blood vessels, and they have the role of kind of coordinating regeneration in your body. They put, a pulse on what's going on in the blood and what's going on locally. They can travel, get into the bloodstream and travel to the site of injury, or they can, coordinate a lot of things in the local area. The thing is, in cord blood, of cord blood the composition is very similar to bone marrow, which contains about 0.1 to 0.01% of mesenchymal stem cells, or MSCs. Right. So it's very, very, very tiny. And that's the issue I encountered as well when I was treating patients, is that, people tend to have a little bit more side effects. They tend to have a more, kind of flu-like symptoms, coughing, sneezing, or tearing eye. So these are kind of a mild allergy. The thing is, the MSCs, mesenchymal stem cells, have the ability to modulate in your immune system, calm your immune system. Actually, it has been used for organ transplantation to reduce the rejection rate. So it has a calming effect. And what I propose is really a combination of umbilical cord tissue cells, which is full of mesenchymal stem cells, and then the cord blood, because like I said, there's no one cell type that fixes everything. And if you talk to any the prominent scientists, that's the consensus, that there's no one panacea. And I always say, God created different cell types for a reason, right? So these cells are there for a reason. They don't just random, you go, I have this cell, that cell. No, it's coordinated. Everything has a reason. So why am I playing God and only deciding that this is one cell type, this is the best one for you, this is the only one I'm going to give you? I want to give people a complement of everything. So umbilical cord blood cells, it's great. It's good for neurodegenerative conditions and helping with blood vessel, new formation, but they do lack the mesenchymal stem cells. So I think it can potentially be very helpful. There are, plenty of studies that are done, like in Duke University, there were treating cerebral palsy and autism with cord blood cells. Unfortunately, they do have a high rate of side effects because they were not utilizing the mesenchymal stem cells. So to me, it's strange, but maybe because they want to simplify it to get FDA indication. I don't know. Sometimes things happening don't make that much sense to me. So that's my sense about cord blood.
Okay, that's awesome. I've learned so much from you. So, I mean, everything that I'm telling you, I'm thinking about, like, it's not from a place of science or research. It's just from, okay, isn't it interesting that there is research now, for example, the stem cell treatment to help autism, that's a neuro brain condition. So surely any of these other neurodiversities that children have, if they have got the opportunity to tap into the stem cell regeneration for their brain, that would be awesome. So that's all I've been thinking, is from a mum's perspective, is there that future opportunity for my son, and in which way?
Mm-hmm.
But other than that, we'll just carry on until something pops up and we might be in the fortunate opportunity to make the most of it. I want to ask you a little bit more about the stem cell regeneration treatments that you offer your patients. What are the best uses that you've found? What are the most common requests by your patients, and what's your top performing formula?
Yeah, so as far as the range of treatment, so I do IV treatments. As far as location, I do facial regeneration, do hair restoration, and of course, musculoskeletal repair, and also sexual wellness. So injection directly into the sexual organs. I would say half of my patients come to me for particular health concerns, and the other half come to me so that they can slow down the aging process. They want to do the healthy aging. So definitely, if you look at the numbers, there's a lot of people who come to me to, try to, preserve as much vitality, or even make them more vital than when they came in, right? So in the sense, getting younger, which I've seen in myself, because I'm religious about getting IV stem cells on myself every 3 months. So I've definitely seen, I that wasn't my intention when I started doing it. I just wanted to reap the benefits of living really healthy. But when I started, to get these notifications from Facebook telling me happy anniversary, and I look back at, photos from years ago, and I was, I got really embarrassed. I was like, wow, that's a terrible photo. Why did I put that up? Because, at the time, obviously I put it up because I thought I looked good. But now I look at it, I was like, why did I do it? That looked terrible. Because in my face, as far as the volume, the skin texture, just the pigmentation, everything, the glow, everything has changed. I've grown younger. And I wouldn't have known that, if not for these notifications. And also I've, heard comments from other people that they've, people who know me for a long time, and telling me that I'm looking younger. So definitely, and of course, it's good to notice in yourself. But I've been giving this lecture at a few conferences now. It's called stem cell therapy as an anti-aging tool. So not only there are objective studies looking at the changes, improvements in people's energy level, sex drive, skin, hair. So all these, kind of aging parameters, but they also have done studies looking at blood composition of certain chemicals, like acetylcholine level in the muscles and in the brain, because they all decline as we get older. So they've done studies, these are animal studies, done studies realizing that after a stem cell infusion, all these levels return to the younger state. So the measurement becomes, what they were when they were younger, sometimes even better than what they were younger. And then looking at inflammatory factors, growth factors. So these are objective data showing that even just a single stem cell treatment can bring about such rejuvenating effects. So that's definitely one big portion of my practice, which is keeping people healthy, keeping them young. If you can prevent the aging process, I say, I tell people anti-aging is very much misunderstood. It's not. My goal is not to live forever. My goal is to live well. I don't want to be sick, right? So I can either live to, age 80, happy, vibrant, doing everything I want, and just, having a great mindset and just, be joyful. Or I'm always hampered down by my aches and pains or breathing issues or breaking out. I don't want that, right? That's, I think most people, I'm seeing a lot of people feel the same way. They don't necessarily want to live forever. I know some people in the field, they do. And to me, it doesn't make much sense to me. But it's about living good years. So that's what, big part of what I do. And then the other part is people who are really sick. I've had people with, let's say, a lot of osteoarthritis, right? Tendon, muscle, joint injuries, traumatic brain injury, Alzheimer's, ALS, multiple sclerosis, so neurodegenerative conditions, and then lung conditions, COPD, very difficult to treat, but works beautifully. The results are astounding. Liver disease, even end-stage liver cirrhosis, it got reversed. It was incredible. And all kinds of autoimmune conditions. Like I saw this lady with psoriasis all over her body, and she got incredible results. She was at her wit's end. She was fairly young, but having such devastating, lesions all over her body. So really from head to toe, people with with other, so autoimmune issues, lupus, rheumatoid arthritis, it works great. And things like plantar fasciitis, I've seen incredible results. And even, like hair growth, even just through IV infusion, I remember this doctor, actually, she was losing hair. She spent some time in Southeast Asia. And then she came back, probably some kind of parasitic, something was her immune system. So she was, she was very frustrating. She kept losing a lot of hair every time she washes hair. And then she did an IV infusion. She said, all of a sudden, I barely lose much hair, every time I'm in the shower. So her hair started to fill out. So it's a lot of, I probably, missed a lot of the conditions, but yeah.
That sounds amazing. I remember being in the clinic, and it was mostly people with knee surgery having the stem cell treatment, but there were, it was predominantly athletes, actually. So athletes had flown in from around the world. We had snowboarders, rugby players, tennis players. They had heard about this clinic and Dr. Saw and the stem cell regeneration, and they were starting to do treatment on tendinitis, which seemed to have an incredibly quick result. So I knew from that time how effective stem cell treatment was for sort of basic injuries to tendons and ligaments. It just accelerated the the opportunity to get back on the field or back on the court or back on in the mountains, you know. So even back then it was having incredible results. So it's so good to hear that so many people have been able to tap into it and get the results that they wanted.
I don't know. Yeah, I don't know if you know, the whole field of anti-aging medicine actually started with elite athletes. So the doctors who founded anti-aging discipline, they were actually working with some of the best elite, these athletes. And all the athletes, they're all working hard, training hard, and they all want to have an edge. So, but no one has a perfect body, right? Perfect system and perfect biology and perfect nutrition. So what can you do to give them that edge? So these are people who are not sick, but you can still make them better. That's how it came about. How do you optimize the human body? And then when they realized that when they optimize these people, they also don't age very as much, right? So you're optimizing the whole system, so it stays optimized. So that's how the whole field came about.
Well, it sort of sounds like it could almost sit into the tenet of recovery. Because if you're a high performance athlete, one of the most challenging things is to get enough recovery to get up and do the thing again at the highest level. So if you're able to help your body regenerate and recover properly, you'd think that stem cell IVs would be the way to go. With the upside of no wrinkles.
I do believe, I just mark my word, one day stem cell therapy is going to be everyday practice. First of all, people are going to, use stem cells, these nature, it's part of nature, it's who we are. We're going to use that to prevent us from declining, from getting sick, stay healthy. And if we do get sick, either an infection or an injury, then, or if we have to do an operation, we'll take stem cells, and then we're going to recover so much faster and so much more completely. Because I already have patients who, right before they get a big surgery, they will do a stem cell infusion, and they astound their surgeons at how fast you recover. Probably, 3 times as fast as what, a person that just, do the usual thing. I think one day it's going to be as common as antibiotics, like it's prophylactic. So prophylactically, instead of preventing you from, getting infections, well, stem cells probably can help with that too, but it can just speed up your healing, just help you regenerate, on super speed.
Yeah, without sort of getting into politics and the whole big pharma conversation, it makes you realize that for most GPs, you say 90%, they are the ambulance sitting at the bottom of the hill, right? So when everything turns to shit, there they are to give you the drugs and what they've been trained to offer. Whereas really the top of the hill should be stem cell treatment or that sort of regenerative, integrative, holistic type medicine. Absolutely. That helps people put that into their life on a daily basis so that they don't have all these things come up. The other part to it is that, we are living longer. We didn't live this long. I mean, if, 100 years ago, if you hit 55, you were considered ancient. and so now, and particularly for women, there is this real desire to look after ourselves in the best ways possible. Because, we are aging, we're living so much longer, but mentally we feel youthful, like we still have this incredible life ahead of us, but the physicality of aging is really the thing that's, making it difficult. So I feel like reaching out and finding out as much as I possibly can, the science of stem cells, the science of aging, which is one of the previous podcast episodes that I've had with Dr. Sandra Kaufman, which was amazing, and to help people understand that it's not all about the drugs, although I'm good with that too. HRT for me. But I mean, hormones are a natural part of the body as well. So it's like as soon as you lose hormones, why would you want to suffer from that?
Because, I remember, the first time I heard about this is when people say, of course, my hormone levels are low because I'm old. But have you thought about if the reverse is true, that you're old because your hormone levels are low?
Yes,
if you brings up your hormone levels, all of a sudden your cells are getting the right signals, getting the useful signals. It's receiving the same information as if you when you were young. So all of a sudden, everything can function at a younger level.
Okay, so the way I'm looking at this now is hormone therapy and stem cell therapy would be my go-to for longevity. Would that be Would you be on my side for that?
Oh good gosh, being in integrative medicine, I think there's so many incredible tools. It's really hard to say, what will be. First of all, I do think stem cell therapy is in a category of its own. The reason I say that is because that's what we're made of. Okay, we all came from a single stem cell. That is the engine that's driving our existence. So it's not about a cell, it's about the intelligence that's contained in the cell. Because what is a cell, right? It has a nucleus, it has DNA, and the DNA has a capability to respond to the environment. So what I call that is these stem cells are the engine. It's like the engine to a car. So this is the engine for our physical body, our vehicle. And everything else is important because you still need the fuel for the engine, right? You need mitochondria to produce energy. You need, the right electromagnetic frequency to optimize the cell functioning. And you need to not have all these toxic stuff in your body. So there are all these things that you need to optimize the engine, but you still need the engine. Guess what? The engine is running really low as you age. So I keep talking about the statistics. It's astounding because people need to understand that mesenchymal stem cells I was telling you about, which is the driver for regeneration. When you were born, every 1 in 10,000 cells is a mesenchymal stem cells. I just call it MSC. And when you reach your teenage years, it's already dropped to 1 in 100,000. So that's 10-fold decrease. You're a teenager, okay? And when you reach your 40s, it's 1 in 400,000. When you reach your 80s, it's 1 in 2 million. So you are running out of the engine. So if you can replace that engine, then all of a sudden you can run your vehicle again.
Yeah, it makes sense. Yeah. Completely makes sense. Yeah. I mean, there's a topic that I'd love to maybe catch up with you again in the future, because I feel like I have so many questions, and I think we're both kind of, well, you've obviously got a lot of the answers, and I have so many questions around the benefits of stem cells, but also about aging and the cells itself. One of the things I'm kind of tapping into, and I'd love to talk to you about this in the future, is the effect on stress and joy. They sound like they're polar opposites, stress and joy, and the effect on aging your cells, and that your cells, you mentioned your cells are incredibly intelligent. They can pick up on that type of thing, whether you are in a happy place or whether you're in a very stressful place, and how that affects how you age. So that's a conversation I'd love to have in the future, that I'd like to have you as a...
You're definitely integrating psychiatry and
yeah.
cell science.
Yeah, because it all goes together, right? I think the conversation really is out there about the mind, body, and soul, or the mind, body, spirit, and how they integrate to affect the whole human. And a lot of the podcast guests I've had in the past, we've either touched on one of those, but I feel like we're coming all together now, and it's so important. I've got one last question for you, Dr. Joy, and it's a left field question. Who inspires you?
Who inspires me? I, from reading books, I don't know of any particular person. There's so many great people throughout history that just have great heart and great tenacity. All these great thinkers. I can't, not anyone in particular. Well, I'm very fond of Charles Darwin. I think he's amazing.
There you go.
I just think, oh my God, look at this guy. The power of observation is so incredible. And so I actually read his book, Origin of Species, when I was 10 years old, in Chinese. And I remember there are all these big words. I was like, what are they? But I was fascinated by what he was talking about, like the different races in humans, and how he thinks different features evolved. I just thought it was the most incredible thing, how miraculous, how we evolve into, having, thinner eyes or longer nose, and it's all adapting to the environment anyhow. But that's, I don't think that's what you're looking for, but.
Oh, no, I think that's fascinating, actually. And you get me thinking, because I'm completely into sort of the science of evolution, the body, and how we get to where we are today, and where we're going in the future with everything that's happening right now around our health around the pandemic and vaccinations and all of that sort of stuff is very, very interesting to see and to stay on top of. If anything, it's accelerating. So it's good to have that background foundation around evolution. So thank you very much for sharing. And it's been incredibly enlightening having this conversation with you.
Oh, thank you. I know we still have so much more to talk about, even just
Yeah.
on stem cells, but we have yet to probably talk about ketamine a little bit, because I incorporated ketamine therapy into my clinic. Talk mind, body, spirit.
Yeah.
Talk about bringing joy and clarity and peace, right? So I
Okay.
think spiritual connection is a huge portion. So that kind of ketamine kind of brought me right back into my whole, my original mission, which is help people to be happier. So the whole mind, how the mind works. And apparently the mind should be connected to something even higher than the mind. And that's something that's not talked about in medicine. It's almost taboo. Spirituality is almost taboo in medicine, and that is too bad. I think that's going to change.
Well, I'm all about breaking open the taboo, opening out the cupboard, shaking out the rug. So let's table that conversation for another time. I'd love to talk with you again. Thank you so much, Dr. Joy.
You're very welcome. Enjoy speaking with you.
Thank you.